Hi guys, Dr. Garvey here. In this video, we're going to be talking about type 2 diabetes. Type 2 diabetes is another one of the most poorly managed conditions in all of healthcare. Very, very poorly managed. But why? Well, you go in, you check in all the boxes, right? You've got these, they do some lab work. Okay, take this chemical cover-up, take this insulin, whatever it may be. They ignore the underlying root cause. Now, the question is, type 2 diabetes, is it reversible? Yes, it is. We've been doing it for almost 25 years at this point, so let me give you a quick background. My name's Dr. Christine Garvey. I've been in practice for almost 26 years now. I've been a chiropractic physician and a holistic doctor forever, and I've been doing functional medicine, helping thousands of patients going through my functional medicine with amazing success. And we have a very, very high success rate if you follow the blueprint. What you need to understand is type 2 diabetes is, you have to fix the cell. In all these conditions, you really do have to fix the cell. But looking at things from a cell perspective, remember, your cells make up your tissues make up your organs. So if your cells are damaged, if they're inflamed, if they're toxic, if they're broken, your tissues are going to be broken, and then your organs are not going to function properly. It's not rocket science. So in order to truly get well, you have to fix the cell. Write that down, fix the cell. In order to truly get well, you have to fix and address the cell at the cellular level. We have to look at the receptors on the cell. We have to look at inflammation. We have to look at the lifestyle factors. What we do as functional medicine doctors is that we dig, we find, and we work towards fixing that underlying root cause, solving the puzzle, not just spending 5 minutes with you and here, take this med, come back in 6 weeks. We're not just trying to fix a bunch of blood work. We're trying to fix the root. We're trying to help to get people healthy, really. We have to look at the foods. We have to look at the nutrient. We have to look at the toxins, the bad fats, the hidden sugars, the inflammation, the cellular health, and gut health. We have to look at things from a holistic perspective, from a global perspective. You're more than just a lab marker. We have to look at the bigger picture, and that's why what we do works so well. So if you're struggling with type 2 diabetes and you want help getting this thing reversed, remember, just look at some stats. Here's the scary things about type 2 diabetes. It's really scary. There's 30 million people that have it. That's 1 in 10. 1 in 10 who have full-blown type 2 diabetes. And it's happening more and more in these children. Type 2 diabetes is a big problem for a lot of people. And it's because of the SAD, Standard American Diet. Filled with sugars and carbs. Carbs are essentially sugar in disguise, right? So the Standard American Diet, that SAD diet, is the fastest way to destroy your health. It's the fastest way to have disease and dysfunction, and usually the end result is type 2. So we have 30 million Americans that have it, but the scary part is that we have 88 million that have prediabetes. We have 88 million Americans that have prediabetes. That's 1 in 3. 1 in 3 have full-blown prediabetes. Let's just call it prediabetes, where if they don't take action within the 5 years, they're going to graduate into full-blown type 2. And a lot of these are kids, right? Type 2 comes with consequences. Your eyes go bad. Your kidneys go bad. You get numb. You get numbness, tingling, and pins and needles, right? The hands, stockings and gloves. You get neuropathy. It starts when your feet get amputated, at your knees. This is a nasty, nasty condition. It's fixable. I've had relatives with their legs cut off, right? If you have a medical doctor that says, no, you can't fix it, right? Get a second opinion, because it's reversible. We've been doing this for almost 2 decades at this point. So your next step, if you want some help, what I do is I offer you a one-on-one discovery call. It's just literally a super easy talk. No pushy sales call. It's not that at all. It's just simply a chance to ask each other questions and determine if what we have would make sense for you. I use the analogy all the time. If I'm trying to get from California to New York and I have a map, it's great. There's a blueprint. If I don't have a map, how am I going to get there? I'd be all over the place. I'd be lost. I'd be frustrated. I'd be getting confused. But if we have a straight line path, do this, do this, do this, do this, test this, right? Avoid this. If I had a straight line, a blueprint, a map to get there, that's what we have with type 2 diabetes. And I want to give it to you. So understand, either myself or one of my partner practitioners, I have a team, will be giving you a call. Most likely it'll be me. But we get the job done when it comes to type 2 diabetes, and again, You'll see on here, click the button, fill out your information somewhere over here on this page. Either myself again or one of my practitioners will call you at the time that you choose. So you pick the date and time and we'll call you then, and we'll find out, what's going on. We could test, and then we have a roadmap to help you. And that's what I want to do. I just want to help people, especially the kids that are getting type 2 diabetes. It's just insanity to me, right? So let's clean things up. Let's look at the cell. And thanks for watching. I'm here for you. Take care. Bye.